You might not think about your thyroid when considering foot health, but there's a significant connection between the two. Thyroid disorders can lead to various symptoms that directly affect your feet, from swelling and muscle weakness to changes in structure. My name is Dr. Andrew Schneider, a podiatrist based in Houston with over 2 decades of experience. Understanding how these issues intertwine can help you manage your overall well being. In today's video, we'll discuss what specific effects thyroid conditions have on your foot health and how you can recognize them. Before I do let others know about these videos, please like, comment, hit the subscribe button, and share on social media. This will help others find the information they need. The thyroid gland, located in the front of your neck, plays a central role in regulating your metabolism, energy levels, and overall hormonal balance. It produces hormones known as T4 and T3, which are critical for nearly every bodily function. These hormones influence how your body uses energy, impacting everything from weight management to temperature regulation. When the thyroid operates effectively, your metabolism functions at its best and you feel energetic and balanced. However, dysfunction can lead to conditions like hypothyroidism or hyperthyroidism. In hypothyroidism, your thyroid produces insufficient hormones, leading to symptoms like fatigue, weight gain, and depression. Conversely, hyperthyroidism results from excess hormone production, causing symptoms such as weight loss, anxiety, and increased heart rate. Understanding thyroid function is crucial to recognizing how imbalances can affect not just your overall health, but also specific areas of your body. The interplay of hormones influences numerous physiological processes, making it vital to maintain optimal thyroid health for overall well being. As you explore further into the link between thyroid issues and foot health, keep in mind how these hormones may also impact your lower extremities. Understanding the complexities of thyroid disorders requires recognizing two primary types: hypothyroidism and hyperthyroidism. Hypothyroidism occurs when your thyroid gland fails to produce enough thyroid hormones, leading to a slowdown in your body's metabolic processes. This condition can result from autoimmune diseases like Hashimoto's thyroiditis, iodine deficiency, and certain medications. When you have hypothyroidism, you might experience fatigue, weight gain, and cold intolerance, which can affect your overall health, including your foot health. In contrast, hyperthyroidism is characterized by excessive production of thyroid hormones, often due to conditions such as Graves' disease or thyroid nodules. The overactivity can accelerate your metabolism, manifesting in symptoms like weight loss, increased heart rate, and heat intolerance. The implications of hyperthyroidism can also extend to your feet, potentially leading to complications such as swelling or pain. Understanding these two distinct disorders can help you appreciate how thyroid function impacts various bodily symptoms, including the feet. Analyzing their mechanisms can guide you in recognizing symptoms and seeking appropriate medical intervention, ultimately supporting better overall health and well being. Thyroid health plays a significant role in maintaining the overall wellness of your body, including your feet. When your thyroid functions is impaired, such as hypothyroidism or hyperthyroidism, it can lead to various foot-related issues. For instance, hypothyroidism can result in swelling, which can manifest as edema in your feet, making it uncomfortable to walk or stand. Additionally, this condition can cause muscle weakness and cramping, affecting your mobility. On the other hand, hyperthyroidism may lead to increased sweating and heat intolerance, resulting in complications like athlete's foot or other fungal infections. Research indicates that thyroid hormone levels can affect the integrity of connective tissues, which are critical for foot function and structure. Poor circulation associated with thyroid dysfunction can also contribute to neuropathy, causing numbness or tingling in your toes. Furthermore, individuals with thyroid conditions can experience changes in their arch or develop conditions such as plantar fasciitis. Therefore, understanding the condition between thyroid health and foot issues is vital for managing symptoms effectively and ensuring overall well-being. Regular checkups and monitoring of thyroid levels can help mitigate these complications and promote healthier feet. A significant number of individuals with thyroid disorders experience swelling and edema, particularly in the feet. This swelling often results from imbalances in fluid regulation due to hormonal fluctuations. In hypothyroidism, for instance, the body may retain more sodium in water, leading to increased fluid buildup. Research shows that this condition can worsen foot discomfort and mobility issues, highlighting the importance of recognizing these symptoms. Edema can arise from poor circulation, commonly seen in thyroid dysfunction. When your thyroid hormone levels are low, blood flow may decrease, causing your extremities to swell. Additionally, the inflammatory processes associated with thyroid disorders, the tissue swelling, further complicating foot health. If you notice persistent swelling in your feet, it's vital to consult your family physician or podiatrist. They might suggest lifestyle adjustments such as dietary changes, increased physical activity to help to manage this issue. In some instances, medication might be necessary to balance hormone levels and alleviate edema. Understanding the connection between thyroid health and foot health can empower you to take proactive steps in managing your overall well-being. Skin and nail conditions often reveal the underlying impact of thyroid disorders on foot health. When you have an underactive thyroid or hypothyroidism, your skin may become dry, rough, or flaky. This dryness can lead to cracked heels and increase your risk of infection. Conversely, hypothyroidism may cause your skin to become excessively moist and even lead to rashes, further complicating foot care. Nail conditions are also affected by thyroid dysfunction. Weak, brittle nails may develop due to hormonal imbalances, making them prone to splitting and breaking. You may notice that your nails grow more slowly or have ridges, which can be a sign of both underlying thyroid issues. Both conditions can have significant impact on your overall foot health. Addressing these symptoms and appropriate thyroid treatments can lead to improvements. Regular moisturizing and proper nail care are essential for maintaining healthy feet. If you're experiencing these changes, it's vital to consult your podiatrist to assess your thyroid function and tailor a management plan that addresses both your thyroid health and your foot care. The effects of thyroid disorders extend beyond skin and nail conditions, greatly impacting nerve function and leading to neuropathy. When thyroid hormone levels are imbalanced, it can disrupt the nervous system's ability to transmit signals effectively. This disruption may manifest as tingling, numbness, or pain in your feet, greatly affecting your mobility and overall quality of life. Hypothyroidism, in particular, is linked to peripheral neuropathy. Inadequate thyroid hormones can result in demyelinization of nerve fibers, which impairs their function. Studies indicate that individuals with hypothyroidism are at higher risk for developing diabetic neuropathy, even if they don't have diabetes. Conversely, hyperthyroidism can lead to muscle weakness and cramps, further complicating nerve health. Addressing thyroid imbalances through medication and lifestyle changes can help to mitigate these nerve-related symptoms. Regularly monitoring of thyroid function is essential for those experiencing neuropathy, as timely intervention can prevent nerve damage. It's vital to consult a healthcare professional if you notice any sign of nerve dysfunction in your feet, as early diagnosis and treatment can significantly enhance outcomes. Weight fluctuations can greatly impact joint stress, leading to various indirect effects on foot health. When you gain or lose weight, your body's mechanics change, influencing how your joints absorb and distribute pressure. Increased weight places additional stress on joints, particularly in the lower body, which can lead to inflammation and pain. Research shows that every pound you gain, your knees experience about 4 pounds of added pressure during activities like walking or running. Conversely, rapid weight loss can also create stress on your joints. It may result in muscle weakness, which can destabilize your joints, making them more susceptible to injury. This instability can lead to compensatory movements, increasing the risk of developing conditions such as plantar fasciitis or metatarsalgia. Understanding these dynamics is vital for maintaining foot health. If you notice significant weight changes, it's crucial to monitor how your feet and joint respond. Engaging in low impact exercises and maintaining a balanced diet can help mitigate stress on your joints, ultimately supporting better foot health. By paying attention to your weight fluctuations, you can proactively maintain potential joint stress and its indirect effects on your feet. Changes in body mechanics, often resulting from weight fluctuations, can lead to an altered gait that greatly impacts foot health. When your body weight shifts, it can affect how you walk, causing compensatory movements that place additional stress on your feet. Research indicates that these alterations can lead to uneven distribution of weight across your foot, resulting in conditions like plantar fasciitis or metatarsalgia. Moreover, if you have a thyroid issue, The hormonal imbalances may exacerbate muscle weakness or joint stiffness, further contributing to an altered gait. This can create a cycle where poor foot mechanics leads to discomfort and an increased risk of injury. For instance, if you lean more on your outer foot due to muscle weakness, you may develop calluses or other painful conditions. Addressing these biomechanical changes is essential. A thorough assessment by a healthcare professional can identify specific gait abnormalities and facilitate interventions, such as custom orthotics or physical therapy. By tackling the underlying issue, you can improve your gait and consequently your overall foot health, helping you to avoid long-term complications. When dealing with thyroid issues, you may notice a significant impact on your energy levels and overall activity, which indirectly affects your foot health. Hypothyroidism often leads to a fatigue, decreased stamina, and a general sense of lethargy. As a result, you may find yourself less motivated to engage in physical activities such as walking or exercising, which are vital for maintaining foot health. Lower activity levels can lead to weakened muscles and reduced flexibility in your feet. This can exacerbate issues like poor circulation, which is already a concern for those with thyroid problems. Additionally, when you're less active, your feet may not receive the same level of support and conditioning, increasing the risk of injuries and conditions like plantar fasciitis. Research indicates that regular physical activity can enhance energy levels and improve overall well-being. Therefore, addressing your thyroid health through appropriate medical intervention can help to restore your energy levels, encouraging you to be more active. By prioritizing activity, you not only support your overall health, but you can also promote better foot health, creating a positive feedback loop that benefits your body as a whole. Effective management of thyroid disorders rely on a variety of medical treatments tailored to the specific conditioning and individual patient needs. For hypothyroidism, the standard treatment involves lifelong hormone replacement therapy using levothyroxine. The synthetic thyroid hormone effectively normalizes hormone levels and alleviates symptoms. Regular monitoring of TSH levels is vital to adjust dosage appropriately. In the case of hyperthyroidism, options include antithyroid medications, which inhibit hormone production. For some patients, radioactive iodine therapy may be recommended, as it selectively destroys overactive thyroid tissue, ultimately reducing hormone levels. Surgery to remove part or all of the thyroid is another option for those with significant enlargement or cancer. It's important to take into account individual factors such as age, underlying health conditions, and patient preferences when selecting a treatment approach. Thorough care may also involve addressing coexisting conditions, including cardiovascular health, as thyroid disorders can impact overall well-being. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. If you notice persistent foot pain, swelling, or other unusual symptoms, it's important to seek consultation from both a podiatrist and an endocrinologist. These signs may indicate underlying thyroid issues that can impact your foot health. Collaborative care between these specialists can offer a thorough approach to treatment and guarantee best results. The link to request an appointment is in the description. Thanks so much for watching and have a great day.